Hello and welcome to this revision session on anatomy and physiology. This is part one. In this session, we're going to cover the circulatory system, the respiratory system, and also the skeletal system. And the purpose of this is to give you a little bit of extra knowledge on top of what you've been learning on the on-screen learning, or it might just be to sort of cement what you have already picked up. And throughout this session as well, I'm also going to, at the end of each section, I'm also going to give you some example questions that you might find could potentially come up or what have come up in past papers to give you an idea of what a question might look like. So before we get going, the exam, if you've watched the Principles of Exercise revision session, the exam for the anatomy and physiology is exactly the same. So it's going to be 40 questions. You're going to have 1 hour to complete it. If you have got additional learning needs and you feel like you need a little bit more support or a little bit more time, then please drop me an email and I will sort that out for you. And the pass mark again is 50%. So we need to get 20 questions right in order to pass the theory side of the assessment. Okay, so let's get started. And we're going to start with the circulatory system. So first of all, what is the circulatory system made up of? So number one, and probably the main thing, is our heart. Our heart is basically a muscle and it's a pump. On top of that, the heart pumps blood. So blood is made up in the circulatory system and it transports oxygen, nutrients, waste products, hormones, and also fights infection. So there's some key roles of blood. And then the blood travels through blood vessels, and that's a transport network throughout our body. And you'll see a little bit more on them, but we've got veins, capillaries, arteries. So first of all, the heart. So where is it located? So it's located in the chest, slightly left of center, and it's behind the sternum. And it's in the thoracic cavity. Now, the sternum is a flat bone that sits as a little bit of protection in front of the heart, around the rib cage, in between the rib cage. The heart sits between the lungs, so there's a lung either side of the heart, and it's protected by the rib cage. So the rib cage sort of sits around, obviously, your heart and your lungs to protect it. And it's approximately the size of a clenched fist. So if you have a look down at your fist, that's roughly about the size of your heart. And the muscle is responsible for pumping blood around the body. I'm sure you all know that, but that's the main role that it has. It's to pump blood around the body. So our body can use it for whatever it needs. Now, there's something within the heart called the sinoatrial node, and that is what initiates the cardiac contraction and gets it contracted. So the SA node is located within the wall of the right atrium, and we're going to look at the heart, a diagram of the full area of the heart in just a minute. But the node is located in the wall of the right atrium, and that is around here. If you can see my cursor, hopefully you can see my cursor there. The SI node is controlled by the autonomic nervous system. So basically that just means, we'll learn more about this in the nervous system, but that just means it's not something that we have to control. It's controlled automatically. And then an average heartbeat or heart rate is around 72 beats per minute. That's on average. The fitter you are, the lower your resting heart rate will be. So let's have a look at the right side then. So the right side of the heart receives blood from the body and pumps blood to the lungs. And this blood is deoxygenated. Now the left side receives blood from the lungs and pumps blood to the body. And that's oxygenated blood. And that's the reason why it's, as you can see from the picture there, the diagram showing a blue on one side and a red on the other. The blue is the deoxygenated blood and the right is the oxygenated blood. And that's the reason why we've got it two different colors there on the diagram. And then atrioventricular valves separate the atriums from the ventricles and prevent the backflow of blood. So there's valves within the heart which basically prevent it going the wrong way, basically. Now the upper chambers. So the upper chambers, known as the atrium, and a good way to remember this is it's the Latin for entranceway. So atrium is the Latin for entranceway. Chambers, these chambers take blood into the heart and receive blood from the veins. Whereas the lower chambers, which are known as ventricles, receive blood from the atrium, ejects blood out the heart to the working tissue or the lungs via arteries, and the left ventricle contains the strongest of the walls. And that's because arteries pump at a very high strength, so it needs to be stronger walls. Okay, let's have a little look at the flow of blood then. So as we mentioned on the last slide, the right side deals with the deoxygenated blood. So if we have a little look down here at the vena cava, which is our main vein, blood flows deoxygenated. Now, looking at this, remember the blue lines are deoxygenated, the red lines are oxygenated blood. So it travels from the body, so back from the body towards the heart, and it comes in through here, through the right atrium. Remember atrium, the entranceway. It comes through here, it passes through a valve and down into the right ventricle. Now, from the right ventricle, it'll travel through the pulmonary artery into the lungs. Now, normally, arteries carry oxygenated blood. This is the only artery, the pulmonary artery, which carries deoxygenated blood. Okay, and this comes around, it comes around into the lungs where the blood will then be reoxygenated, and we call it gaseous diffusion, which we'll have a look at on another slide. That then travels into the left atrium, again passes through a valve and through into the left ventricle. And then from the left ventricle, it travels through the aorta, which is our main artery, and pumps the blood to the rest of the body for use. And that is how it travels through the heart, the body, and the lungs, and it's a continuous cycle. So the main role is to take deoxygenated blood from the heart to the lungs to be oxygenated. So that's the right side of your heart. The left side, the main role is to carry the oxygenated blood to the body. So they're the key differences between the two. Yeah, so we've got a little bit more on that. So hopefully that gives you a better understanding of how the blood flows through the heart. There will be a few questions on this, so it's good to have a look at this. There's some really useful videos on YouTube as well, which will help you see it in better form, if you like. So you can actually see the blood flow going through, and it's more like an animated video. Okay, so some key terms: heart rate. Hopefully you know that's the number of times a heart beats per minute. Stroke volume refers to the amount of blood ejected each beat of the heart. So every time it beats and blood is ejected from the heart, that's known as stroke volume. And then the cardiac output is the volume of blood circulated per minute. Cardiac output equals your heart rate times by your stroke volume, and that gives you your cardiac output. So they're just some key terms for you to think about. So let's look at blood vessels now. So the first thing we'll look at are arteries. So as you hopefully you remembered just from that description of the flow of blood through the heart, arteries travel away from the heart and they carry oxygenated blood. Remember, apart from that pulmonary artery that I mentioned. They have thick muscular walls, and the reason they have them thick muscular walls is because they work under high pressure, because it's got to get the blood out to the body, to the upper body, lower body, all over the body. So it needs to work at high pressure. And smaller arteries are known as arterioles. Veins. So veins travel towards the heart and they carry deoxygenated blood, again, except for one, which is the pulmonary vein. They are thinner walls and they have valves. So as you can see from the little diagram there, the wall's thinner compared to an artery wall, and they've got valves, and that is just to prevent the backflow of blood. They work under lower pressure because they're returning the blood to the heart. And smaller veins are known as venules. Ooh. On to the questions now. But let me just check something. No, I just want to touch on this little bit here, this little part of the diagram. So as they meet, this will probably come up in the respiratory system actually, but as arteries and veins meet, you'll see these little branches here, and these are known as capillaries. But yeah, we'll touch on that on the respiratory section. So here are some typical exam questions on the circulatory system. Now, these have been in past exams. So first of all, let me bring up all 4 questions, and we'll look at the top left. So first one, where is the heart located? Is it A, outside the pericardium? Is it B, behind the sternum? Is it C, below the diaphragm? Or is it D, in front of the lungs? If you've watched the Principles of Exercise revision, you'll probably have heard me say this, but I'll repeat it for this one. If you're not quite too sure of the answer, a lot of the times with these questions, you can start to eliminate the ones that you definitely know it's not. So try and do that with each question where possible. If you feel like you don't know the question, feel free to move on through the exam. You've got 1 hour to complete it, and you can come back to questions to answer it. So yeah, don't worry about doing them in the complete order. Anyway, that first question, where is the heart located? So if you set a pause it there, if you want to have a little go. But if you said, oh, second one's come up. If you said B, then you'd be correct. It's behind the sternum. Remember, that's the flat bone that sits at the front of your rib cage. Let's go to the one to the right then, because we've revealed that answer. But which of the following is located between the upper and lower chambers of the heart? And that's valves. Remember, we said we don't want it to return, so it needs to go in one direction. So the valves are what stops it, the backflow of blood. Pause it there to have a go at the next one. But what is the purpose of the heart? Is it to stimulate the lungs to breathe? I've put lunges there. Apologies for that. Is it to pump blood around the body? Is it to provide blood cells with oxygen, or is it to stop blood flowing in the wrong direction? So what's the purpose of the heart? Yes, it's to pump blood around the body. And then the final one, the average blood pressure for an adult is 120/80. What is the name of the first value given? If you remember from the Principles of Exercise, I discussed this. So there's systolic, diastolic, pulmonary, cardiac, and the answer is systolic. Diastolic is 80 on that example. So you've got your systolic first, when your heart actually pumps, and then when it relaxes and refills, that's diastolic. There we go. So there are some typical exam questions on the circulatory system. Okay, the next one we're going to go through is the respiratory system. So think about your lungs and breathing. The respiratory system will work closely with the cardiovascular system, making it together the cardiorespiratory system. So you might hear it referred to that. So that's basically the heart and lungs working together. The respiratory system is responsible for taking oxygen into the body and removing carbon dioxide out of the body. And the circulatory system is then responsible for pumping and carrying the oxygenated blood to the working tissues and then pumping the waste products back to the lungs to be expired through breathing. So the lungs, first of all, let's have a look at them. So they're the organ that is responsible for breathing. I'm sure you all know that. And they're located in the thoracic cavity. The right lung has 3 lobules and the left lung has 2 due to the heart's positioning. So as you can see from here, there's 1, 2, 3, and this is where the heart would sit, obviously on the left side. So it's flipped round, but that's where the heart would sit. The function is to take oxygen in and remove carbon dioxide, as we just mentioned. Spelt lungs right this time. Now the diaphragm. So the diaphragm that you can see here sits under the rib cage. So it's the main respiratory muscle. It's dome shaped when relaxed. and it flattens when it contracts. Intercostal muscles and pectoral minor, should I say, assists the diaphragm by elevating the rib cage. So intercostal muscles are the muscles that kind of sit in between the ribs. Pectorals you'll know as being your chest, but the minors slightly lower than on your chest, and they assist in helping the diaphragm by elevating the rib cage. That just allows the diaphragm to expand once you take in your lungs to expand, should I say, once you take in the air. And this is how it looks. So inhalation, this first column here, when we're breathing air in, the diaphragm contracts and flattens. Intercostal muscles and your pectoral minor contract and elevate the rib cage. The chest cavity then increases in volume because air is sucked into the lungs. And then the opposite when we exhale. So the diaphragm relaxes and returns to a dome shape. Intercostal muscles relax and the rib cage depresses. The chest cavity then reduces in volume because we're getting rid of that air that's in your lungs, and air is forced out of the lungs. The lungs are never empty. There's always a residual amount of air in there, and that's just to prevent the lungs from fully collapsing. Okay, and looking at the passage of air through. So we start obviously in the nasal cavity, or the oral cavity. That's where obviously you breathe the air in. It passes through next through the pharynx, then through the larynx. So you might remember, oh, sorry about that. You might know them as your voice box and windpipe. You've got the trachea. We've also got the right and left bronchus that come here. They're the ones that split off and go towards the lungs. And then obviously you've got your right and left lung, and you can see that lung shape again where the heart would sit. And there's your diaphragm that's flattened underneath your lungs. If we zoom in a little bit to this little area here, so the bronchus, this is how it looks zoomed in. So this is the bronchus, and then it leads off here, and you've got the bronchioles, which are these branches which lead down to alveoli, which are these air sacs in here. And if you notice these little red and blue arteries and veins, they're what we discussed before, where they turn into capillaries. And this is where the gaseous exchange will take place. So the reoxygenation of blood will take place within these arteries and veins. Here we go. So gaseous exchange. Diffusion takes place within the alveoli, which are these little air sacs. Alveoli are surrounded by capillaries, as I just mentioned, and these are blood vessels that are a single cell thick and allow gases to diffuse within there. So really small. So what's the air made up of? It might be quite surprising for some people. So the air we inhale is actually 79% nitrogen. It's only 21% oxygen, and it's under 1% carbon dioxide and 0.001% trace gases. And then the exhaled air, should I say, is again 79% nitrogen, 17% oxygen, and it's 4% carbon dioxide that we give out. And again, trace gases is the same. So as you can see, there's no difference in the oxygen. There's a 4% decrease in oxygen, and there's a 4% increase in carbon dioxide. So lung volumes and definitions. Tidal volume is the amount of air inhaled and exhaled in one breath. We have something called minute ventilation, which is the amount of air inhaled and exhaled in 1 minute. We have breathing rate, which is the number of breaths per minute, and the average is 12 to 15. Vital capacity, which is the maximum forced exhalation following maximal inhalation. And then we have something called residual volume, and that's what I mentioned before. So it's the amount of air that's left in the lungs following vital capacity. So there's always something left within the lungs to prevent collapse. Again, it's loaded up a little bit weird, but here are some typical questions. Gave the first one away. So the lungs are structured perfectly for its role of what? Is it A, gaseous exchange? Is it B, ingestion? Is it C, vital capacity? Or is it D, tidal volume? So vital capacity and tidal volume are related to the lungs, but it's not why the lungs are structured the way they are. Ingestion is nothing to do with the lungs. It's obviously eating. And then gaseous exchange is your answer. Looking down at the next one, which of the following is a muscle which plays a role in the breathing process? Is it the rectus abdominis? Is it the gluteus maximus? Is it the diaphragm? Or is it the pericardium? And hopefully you said diaphragm, but I'm not going to release that yet in case I've picked this one next. So the next one, the air that we breathe in enters the nose or mouth before moving directly to the what? So remember that passageway of oxygen or air we breathe, should I say, rather than oxygen. Which one does it pass after it's gone through the nose and the mouth? And hopefully you remember it is B. So we've got C for the diaphragm and we've got B for the pharynx. And there's some typical questions that may come up. Okay, moving on now to the skeletal system. And I believe this is the last section of today. Just wanted to cover a few anatomical terminology because you'll see these quite a lot, especially I would say anterior, posterior, medial and lateral. You'll see them quite a lot, especially when we get onto the muscular system. So anterior is basically at the front of the body, so anything at the front of the body. Posterior is at the rear of the body, so post. Think of something that's happened in the past, post. That's how I used to always remember it. Medial sounds like middle, so it's towards the midline, and lateral is away from the midline. Inferior is the lower aspect, and superior is the upper or higher aspect. You'll probably remember that as if something superior, or if a superior member of staff in the hierarchy is higher up. So you might remember that from that. Proximal is closer to the trunk, which is our midsection. If you think of that, the where our center of gravity is right in the middle. Distal is further from the trunk. Superficial is close to the surface. You might remember that if you've done a first aid course with superficial burns. And deep, as you can imagine, is further from the body's surface. So just some terminology that may come up. Now, there's 6 functions of the skeleton. PMS is a good way to remember them. So first of all, we've got protect, movement, storage, production, muscle attachment, and we've got support or shape, you might see that as. So first of all, protect. What does that mean? So think of your skull is protecting your vital organs such as your brain. Think of the rib cage protecting your heart and lungs. So we've got bones that protect. Skeleton is obviously there for movement. It attaches to bones and we move. Storage of minerals such as calcium, so that's important. Our bones store calcium. They also produce red and white blood cells. The function of skeleton is muscle attachment, so muscles will attach from bone to bone to keep us into the next one, which is support and shape. So if we didn't have them muscle attachments and we had no support or shape, we'd just collapse. So they are the 6 functions of the skeleton, and there are approximately 206 bones within an adult skeleton. Within a child or a baby, there'll be a lot more than that, and then the bones fuse together to create bigger, more sturdier bones. That's why kids kind of just bounce, and as you get older, you get less flexible and less, more brittle, should we say. Okay. There are two types of the skeleton. There's the axial and there's the appendicular. So the axial is made up of the cranium, seeing these light blue colors here. So we've got the cranium, we've got the vertebrae or the vertebrae column, think of your spine, and then we've also got the ribs. They're the only part of the axial skeleton. So think of the main branch right down the center to remember that one. And then the appendicular, looking at the red colors there, is everything else. So you've got your shoulder girdle, which includes your clavicle and your shoulder blade. You have got your arms, so your upper limbs, and you've also got your pelvic girdle around here, like your hips, and then you've also got your lower limbs. So everything else. Now, bones, there are different classifications for bones. So we have short bones, irregular bones, flat bones, and sesamoid bones. And I'll give you a couple of examples of each, but I'll give you some characteristics for all of them as well. So first of all, short bones. So they're cube shaped and they're highly cancellous, and that means like spongy. They're strong and light. An example of that from what you can see from the picture there, your carpals and tarsals, so like in your fingers and your toes, or more your fingers, should I say. Irregular bones, you've got random shapes. There's lots of muscle attachment sites, and the obvious one is your vertebrae, which is pictured there. So think about the discs in between. Your calcaneus, I can never say that word properly, but that's your heel. Flat bones, think of your scapula is the one that springs to mind. Also that we talked about before, your sternum that sits in front of your ribs. Even your ribs are flat bones as well, but they're thin and cancellous again, and they're compact bones surrounding. And they provide protection. That is the main role of them. Again, think of your cranium or your skull. Sesamoid bones, you have, they normally develop within tendons and they act to protect the joint. And an obvious one of that is your patella, which I've pictured there, so your kneecap. So they're the 4 different types of bone classifications. Now let's look at the structure of a long bone. So we've got the short bones, irregular bones, flat bones, sesamoid bones, and then finally we've got long bones. And they're the ones that you'll see in your arms and legs, so the longer bones. Now, at the top, at either end of a long bone, we've got something that's called the epiphysis, which is the end, basically, and we've got the diaphysis, which is the middle or the center. You don't need to know too much of the insides of it, but there's something coming up later on within there which explains these terms a little bit better. But that is the makeup of a bone, and then either side you'll have a cartilage. Within there's a bit of sponginess of the bone. But yeah, there's not too much you need to know in depth about the actual structure of that bone. Bone formation now. So that is known as ossification, and it's the formation of bone through activity of osteoblasts and osteoclasts. Minerals such as calcium are essential for bone growth. So you remember from all, like, you'll probably know from like milk adverts and stuff, milk's quite high in calcium, and it's always recommended for strong bones, isn't it? If you remember, it's something that companies and branding and marketing really jump on that because it's quite high in calcium. Ossification isn't usually fully complete until between the ages of 18 to 30, which is quite late. Osteoblasts, and a really easy way to remember that is the B, which I've highlighted there. That's the building and formation of new bone. And then osteoclasts is a cleaning, or you might see it as clearing, cleaning or clearing. So it's like the removal of old bone. Osteoporosis is the degeneration of bones, which become brittle and then are more at risk from fractures or breaks. And bone density can be affected by any of the following. So it can be poor diet, it can be a lack of calcium, a lack of vitamin D, it can be the menopause, it can be amenorrhea, which is the loss of a menstrual cycle, or the abnormal loss of a menstrual cycle, should I say. And it could be due to a lack of weight bearing activity. So some key things that you could recommend people to do is weight training, increase the vitamin D and increase the calcium intake would all help towards getting stronger bones. But remember, osteoblasts build, osteoclasts clean or clear. This has come up wrong as well. But here are some typical exam questions. So which of the following is part of the axial skeleton? Again, pause this if you want to have a little go at this point. But that answer is C. So it's the thorax. The process of ossification for bone growth use, and that is B. So remember, calcium and bones are very closely linked. Which of the following is not a function of a skeleton? Protection, movement, maintain temperature, or production of red blood cells? Hopefully you said maintain temperature. We know it's there for protection for the skull. We know that we need a skeleton to move, and we know that bones produce blood cells. And then finally, which of the following is part of the appendicular skeleton? We've got cranium, ulna, sternum, and vertebrae column. So if you have a look, if you have a remember, so we've got the axial and the appendicular. Remember, there was 3 that made up the axial. That was a cranium. That was the vertebrae column. That was a sternum. So the answer to that one is B, ulna, or sternum and ribs, should I say, with that one. So there you go. And now we move on to the spine. So the spine is made up of 4 key areas, but you can potentially say it's 5 with sometimes the sacrum and coccyx are sort of linked together when discussed. So we have the cervical right at the top. That consists of 7 vertebrae. We have the thoracic, which consists of 12. We have the lumbar, which consists of 5. Then we have the sacrum, which consists of 5, and the coccyx, which consists of 4. Sorry, and they are fused, which means there's no discs in between. They're just fused together. I'm going to talk about the curves in another slide. Now, so they're the regions we just talked about. We have the cervical, thoracic, lumbar, sacral, and coccyx. Coccyx, should I say? The vertebrae are all there. The numbers. The movement at each is listed there. I'm not going to run through them all with you because you can keep these slides to have a look through. But it gives you the movement that happens within each area. And these are some spinal deviations now. So obviously the first one you can see there, A, is a normal curvature of the spine. That's how ideally our spine should look. So there's a natural curve here at the cervical, there's a natural curve here at the thoracic, and then it comes back in for that natural curve of the lumbar spine. And then we have the pelvic curvature there, which is the sacrum and coccyx, like the tailbone. Now, there are some deviations. B is scoliosis, which is a sideways curve of the spine, as you can see there. This is normally from birth. This deviation. Kyphosis, which is a very common one. You'll often see the rounding of the shoulders. So there's excessive curvature at the top. This is very common for people that have desk jobs and sit down quite a lot. Also, if people have overdeveloped certain areas, so work the chest more, or tight chest or tight back muscles, it can pull them forwards. And so bodybuilders can be quite often in that position. And then we have lordosis, which is more of a curvature of the lower spine then, so your lumbar spine. And that's known as anterior pelvic tilt, so where your pelvis is tilted, and you've got excessive lumbar curve on that one. And here are a couple of questions that you might get asked. So postural deviations may include a sideways curvature of the spine. This type of deviation is known as, pause it here if you're having a little go, scoliosis. Postural deviations may include an excessive curvature of the thoracic area of the spine. This type of deviation is known as what? And that's kyphosis. Just to let you have a little look at that. So we've got the scoliosis, which is the sideways curve, and we've got kyphosis, which is the thoracic. See the thoracic here? That's excessively curved, so that's kyphosis. And then scoliosis is this one. There we go. Finally, we come on to joints. So we're almost there now. What are joints? So it's an area where two or more bones meet. And there are three classifications as joints. We have fibrous joints, which are fixed or removable with interlocking bones. So if you think about the plates of the skull that are stuck together, they don't move, which is a good job. Cartilaginous joints, the name gives it away. It's like they're connected by cartilage, but slightly movable joints that are connected by cartilage. Think of your vertebrae and the discs in between. And then we have synovial joints. So these are freely movable and are the most common found in the body. And they're all listed at the bottom there. So think of your ankle, knee, hip, shoulder, elbow, and your wrist. And these are the types of synovial joints that we have within the body. So we have a ball and socket, which is a multiplanar movement. So there's loads of movement within ball and sockets. And the most common one is shoulder joint, but also your hip joint is a ball and socket as well. Hinge. So think about your hinge, think about the elbow. A really good way to think of that is think of hinges on a door. They just move one way. If you think of a hinge, it just opens and closes. If you hold your arm out in front now and bring your palm towards your face, that's a hinge joint. So it just moves in that one direction, which is flexion and extension. It occurs at your knee, your ankle, and your elbow. We have a pivot joint, which is rotational movements. So think about your neck and your forearm. We have saddle joint, so movement in two planes. So that's back and forth and up and down. Joint and base of the thumb. So think of your thumb and your fingers moving. Gliding joints. We have movement where two bones slide across each other. So think of your scapula and your clavicle, or your shoulder blade and your mine's gone blank. Collarbone. There we go. Ellipsoid or condyloid. They're similar structure to a ball and joint socket, but there's less movement there. So they're the knuckles and also your radius and carpals. And here are your movements. So if you look at the top, the columns here, we've got flexion, extension, abduction, and adduction. Good way to remember them is abduct, you're taking away from the body. Adduct, you're adding back to the body. We've got rotate or rotation. We've got lateral flexion, plantar flexion, dorsiflexion, and we've got protraction or protract and retraction or retract. And we've got elevate and depress. And all these movements will be all on the on-screen learning, so you can see actual videos of that occurring. But it just tells you then down this side each joint and what movement can occur at them joints. So it's quite a handy chart to keep close. And here, to finish off, I have not got it up. Let me see if I've got it open here. Go. Let me take you to this one. Let me just share my screen with you. There we go. Answers are on there, but just so you can have a little go. I should have told you to pause it, but which of the following is classified as a type of joint? We've got A, swing, B, sliding, C, pivot, D, grinding. So it's, hopefully you know that, it's C, which is a pivot. Which type of joint does adduction, or at which type of joint, should I say, does adduction occur? And that is A, it's a ball and socket. And then two bones in a joint are connected by which of the following? So is it tendons, ligaments, muscle fibers, or filaments? And that is B, ligaments. So if you always remember, bone to bone is ligament and bone to muscle is tendon. And that's how they're attached. And that brings us to the end of the session. So I hope you learned something in that, and I hope that gives you a good indication of what types of exam questions could come up. Have a look at the YouTube channel at the part 2 of this, where we will cover the muscular system, the nervous system, and energy systems. Thanks for tuning in, and I will see you very soon.